Well, good evening, everyone, at the Long-Term Care Community Coalition annual fundraising event. If you want to help fight for the rights and well-being of people in our nursing homes and adult homes and other long-term care institutions, you have come to the right place, because there is no organization in New York State that is better equipped, with a better reputation and better values and expertise and energy and experience in fighting for long-term care residents and their well-being in New York and maybe in the country than the LTCCC. And I say that with the utmost enthusiasm and gratitude to LTCCC. It is, I always say, I rely heavily on the coalition. I don't think I could be doing the work that I've tried to do for the last 3 decades in relation to nursing homes and adult homes and the like, without the information, the guidance, the expertise, the analysis, the values, and the energy of the coalition. So you have come to the right place. Every year in the state budget, I fight to get as much money as I can to help fund the coalition. You might think, well, with an over $200 billion state budget, how hard could that be? But as it is, in the budget every year, when we try to get additional allotments for various designated organizations that I try to help, kind of the reaction I get from our Ways and Means staff is kind of along the lines of, for crying out loud, the health committee's part of the budget is already 45% of the state budget. How much more do you want? And well, the answer is, if we want the rest of the money that we spend on healthcare, on Medicaid, et cetera, to be well spent, we need to be helping out a lot of very specific, very focused organizations. And every year, helping to get funding for the coalition is one of my top priorities. And I remember one year under a certain governor who shall be nameless, the state health department tried to screw the coalition out of the money that we had designated for them in the state budget. And I had to throw a small fit to get that corrected. And I was annoyed that I had to do it, but I was pleased to do that fight and to win, by the way. And whoever is the new chair of the health committee in January is really going to need to work hand in hand with the coalition. And so the coalition really needs your support. I will be leaving, for whoever the new chair is, who will be appointed by Speaker Hastie. I will be leaving that person a list of a small number of individuals and advocates and organizations that I think are really important to work with and rely on. And I can assure you that one of my number one recommendations to the new chair will be to get to know the Long-Term Care Community Coalition and work as closely with it and rely on it as much as humanly possible. So the coalition has earned your support, needs your support, and I want to thank them for recognizing my work over the years. But more importantly, I want to thank the coalition and thank you for being here tonight in support of the coalition. Thank you.